Hello everyone, this is Dr. Mira from the Padarthi Summit. Today we are going to discuss how to strategize an important exam stage in the PPROM at 26 weeks of pregnancy. For the next few minutes we will deal how to go about the station. The candidate instruction given to you is about a woman who has come to see you, the registrar in labor ward. She is at 26 weeks of her pregnancy. She has come with leaking per vagina. Your task is to explain the diagnosis and management and address her concerns empathetically. Here if you note, you can see that the patient's previous pregnancy detail is only given, the mode of delivery is not mentioned. So this you make sure you need to elicit. And she has leaking per vagina. This is all that is given there. The rest of all the information you need to elicit from the role player. The role player information specifically mentions that she has delivered by previous cesarean section and she is allergic to penicillin. And she has some questions which she'll be asking at the end of the station. Now this is a patient who has come to labor room very early. So this is an anxious patient and you are the labor ward registrar. So make sure you maintain a neutral tone. Introduce yourself. Do not forget to introduce yourself and confirm the role and confirm her identity and give an open question of what is happening. Once she says her main concern, validate her, create a rapport by saying that I know this is overwhelming. Right now I need to ask you some questions, know more about you. Is that fine? And go on to ask the red flags. Does she have any heavy bleeding, feeling unwell? Does she have any fever? Does she have any foul smelling discharge from her down below, from vagina? So these are the questions you ask to rule out any immediate red flags. So once you have ruled out all these conditions, you will be asking an open question about her primary concern. So she'll tell you her whole story that she has been leaking for the past 2 hours now, and this is the first time she has had something like this. And previously the pregnancy has been going on well, everything had been all right. Now she is worried that this is too early. So you will rule out a background, any infections which had been going on previously, any surgeries had been done at the neck of the womb, any previous preterm births, right? All these information. She has been smoking and how she is being supported in the family, because domestic violence can be presenting to us this way. So these are the initial information that you will be eliciting from the patient. At the same time, make sure you go on empathetically, because she is very anxious and she is here very early and she has another baby who has to be taken care and she is distraught. So address that mental status rather than asking how she has been going on for the past 2 weeks. Address her anxiety right now. This is how you showcase your examination of the mental status. Further on, for cases like this, PPROM, a preterm birth, the most important thing not to miss is about the allergy. So here this patient is allergic to penicillin, and your job does not end with eliciting this information alone. You need to ask what type of allergy she has had following the injection, and you need to document that. Whatever she says, I'll be documenting that she is allergic, that you are allergic to penicillin. So this is how you communicate with the colleagues that she is allergic to penicillin. Just eliciting the information is not sufficient. So once you have mentioned that, go on to the rest of the information which you think is relevant, like blood group, how she delivered previously, how her recovery was following the cesarean section, how long back that was, right? And what is her blood group, what are her reservations for transfusion, does she have any reservations at all? So those informations you'll be eliciting and you'll proceed on to the examination. Make sure you mention the examination in the presence of chaperone with her consent. Make sure you look at her temperature, how the baby is doing right now, and you will be doing a gentle examination by inserting an instrument called speculum to see what kind of leak she has, and you might take a test to confirm that, if needed, to confirm that this is indeed PPROM. So this you need to mention her And further on, you might do an ultrasound to check how the baby's position is. Right? So these are all the examination points we will be mentioning. So at the end of 4 minutes, you should have elicited all the background information, including the allergy, and your mind should be ready with this summary. The summary is that she is a PPROM patient in the background of previous cesarean section, and she is allergic to penicillin. And she has a social concern that how long she is going to be admitted, what is going to happen to her baby, how long should I be staying in the hospital at all, can I be discharged. So these are all the social aspects that she is going to ask you. So following your summation, you are going to explain whatever this is. Explain clearly what is PPROM. So this patient has had previous pregnancies. She knows about what does it mean to have what is broken. So go on to explain that. It seems to us that the waters have broken prematurely, and this has happened before your 37 weeks of pregnancy. This is what we call PPROM. So this is something which can happen due to various reasons. Most often we don't know why exactly this has happened. There could be some risk factors like smoking, previous preterm birth, or some infections, but we cannot be sure why exactly this happened. Most of the candidates will mention what is PPROM and they'll go on to start the management plan. They'll not tell why this has happened and why management is essential. This the patient needs to hear, right? This the patient needs to hear that she is not at fault. Most often we don't know why this has happened. There could be some risk factors. It's important to be managed because there is an increased risk of infection to the baby and to you if we don't treat at present, right? So you go on to the further management plan. Make sure you mention the names of the colleagues at the start of your management plan. Otherwise, because you have a lot of information to share, this crucial domain gets missed. So you will be managed by a group of doctors involving my consultant, the neonatologist who takes care of the baby, and the specialist nurse, the midwife, and the GP will be in the loop, and the midwife, your midwife, will be in the loop. And following that, you go on to mention what are all the treatment aspects that you are going to give her, covering the steroids, which is going to help the baby's lung mature, antibiotics for both PPROM and if she were to deliver preterm, this is also going to include the intrapartum antibiotic prophylaxis. So right now she is going to take erythromycin, which is safe to be taken during pregnancy. This is going to be given for 10 days, 4 times per day, till she is in labor, whichever is sooner. So following that, you are going to go for the preterm birth. If she is going into preterm birth, you will be offered another antibiotic. But because you are allergic to penicillin, here she has mentioned to have severe allergy. So you will be offering her a safer antibiotic, that is vancomycin. This will be given to you if you were to deliver before 37 weeks. This is to make sure that the baby is protected from serious infections. So once you mention that, you go on to the other aspects of preterm like magnesium sulfate if she is going to deliver within 34 hours, 34 weeks, and the next 24 hours you are going to start with the magnesium sulfate. This is going to protect the baby's nervous system. And continuously, since you are at risk of infection, we will be monitoring you and your baby. Initially, we are going to offer you admission, right? This is the most important aspect which can be missed. Because you have a lot of information, certain crucial aspects like this will be missed. So you start the management this way with information about colleagues, that you are going to be admitted. These are all the further things that we are going to do, and you will be monitored this way. And further on, if you have any red flags in between, we will be escalating. So this is how we deal with this station. Make sure you chunk the information. Following each information, ask for her understanding. Invite doubts. Do you have any other questions? Are you with me? Am I making sense? I know this is overwhelming. It is important to take care because this is the risk. So this is how you go on with further details, right? Address her social concerns also. She will be worried that she has a child at home. You validate that, yes, I do understand, but your concern, our concern is your safety at this point of time. We can arrange for any social support, or is there anybody whom I can call to make sure your child is doing all right? So this way you can support her. Explain why admission is advised right now. It's important to make sure there is no infection, and we need to make sure you are doing well by taking some bloods and also evaluate your baby's condition right now. So initial management involves admission, and once you are stable and the baby is doing all right, we might discuss with the consultant, and if you are nearby, we can think of discharging you with regular follow-up. We'll also be offering you written information of what it means to have the PPROM, that is waters broken early, right? So this you will be mentioning to her. Reassure her that you will review regularly and may consider discharge later if she is stable. Make sure you document your discussion, make sure you document the management plan, and you'll be discussing about her with the consultant. So summarize the management plan, emphasize that close monitoring is essential, and do you have any further questions at all? I'll be with you. So this, by the end of 10 minutes, you should be able to cover all these things. Now, when you look at the domains, how does a pass candidate deal with this? Initially, once she has come in, the pass candidate is going to give an open question which gives the whole lot of information, and whatever details were missed will be asked by closed-end questions. When you don't go for the previous cesarean section details, or when you did not elicit this penicillin allergy, it is one of the most critical aspect of the information gathering domain. So make sure you do not miss that. So any PPROM or previous PPROM or preterm birth station, the allergy is one of the key informations that you have to elicit. Make sure you confirm the diagnosis by offering a speculum examination. These are all the information gathering points. As for safety, you know that this is PPROM. You need to make sure you mention the management part involving the steroids, antibiotics, and allergy appropriate treatment for the patient. And document the allergy. Not just eliciting is essential. Documentation is the most critical. So document that she was allergic to penicillin and mention that a safer alternative will be offered that is going to be baby friendly, and how she is going to be monitored. All these key details will be mentioned by a pass candidate. Applied clinical aspect is when whatever knowledge we have gained so far, we are going to apply in the current situation. Usually in the applied clinical knowledge for this station, candidates might get borderline if they don't mention critical details like why this has happened, why the management is essential. If these two things are not mentioned, it might show that you do not have an understanding of why the treatment is essential. So make sure you go about what is happening, why this has happened, why it is important to manage. So this is how we show the applied clinical aspect. Communication with the patient, most of us will be able to crack this. We sound empathetic, we give an open question, we lend an ear, we chunk the information, we ask if there is any concerns, and we offer PIL. So this is how we communicate with the patient. Communication with colleagues, it's one of the easiest domains in this station. You just need to mention the colleagues, tell her that she can visit the NICU, make sure the NICU beds are available at present, and document the allergy, and make sure you do not miss out on this. So start your management plan with communication with colleagues. So overall, globally, if you are a safe and confident and structured candidate, you are going to score the maximum in this station. If you miss out the key details like why this is happening, what we are going to do, and what if there is any red flag, what are the further steps that we are going to do. If certain things are missed, there could be the deficiency which is going to cost us in terms of a score. Make sure you do not miss out on the allergy, the previous cesarean section details, or the preterm care related, PPROM care related details. That will be a unstructured aspect of the station, right? So make sure you do not go unprepared for a simple station like this. Everyone has skills and talent, but not everyone has a strategy. So develop the strategy, and that is only by practice, practice, and practice. So today, signing off from you, Dr. Mira Kumar. Sign up for more. Bye bye.